Hello guys, welcome to the MedDC, and today we are going to talk about the short review of the heart failure. So what is the heart failure? So the heart couldn't pump blood effectively to meet the body's needs. That's called as a heart failure. So what is the normal function of the heart? It's pump the blood into the aorta and in the systemic circulation. But in the heart failure, heart can't pump properly, means inability to contract, which leads to the reduced cardiac outputs. That's called as a heart failure. It is a simple definition of the heart failure. Then we will move to the causes. In the causes, which includes coronary artery diseases. In the coronary artery diseases, example in the atherosclerotic plaque. So in the heart, in the cardiac muscles, which is supply the blood is supplied by the coronary arteries. So if the coronary artery is there and it is blocked by the atherosclerosis plaque. So if the plaque is there, in that particular region, the blood supply is getting reduced to the cardiomyocytes. So when the blood supply is reduced, which leads to the ischemia and death of the cardiomyocytes and causing the inability to work. So when they can't work properly and they can't contract, which leads to the heart failure in these patients. As I mentioned, the coronary artery diseases in the CAD, same thing happening in the myocardial infarction too. Next we will move to the hypertension. In the hypertension, the patient has increased afterload. When the patient has increased afterload, because of that, heart want to pump more hard to bring the blood out, which leads to concentric hypertrophy of the left ventricle, and further it leads to heart failure in these patients. And valvular heart diseases. In the valvular heart diseases, we can talk about the stenosis and regurgitation, and in other videos I will talk about more detailedly, but in here I will give the basic idea. In the stenosis and regurgitation, the patient in the stenosis case, the heart want to pump more hard to bring the blood out. In this case, it's lead to the hypertrophy of the cardiac muscles, which causes the more workload to the heart, and which further it leads to the heart failure. In the regurgitation persons, which in the heart, it had the more blood, means in the volume overload in the heart, and which leads to the heart failure. Same thing, because if the volume is overloading in the heart can't pump because it's getting overstretched, so heart can't pump properly, which causes the heart failure in these patients. That's about the valvular heart diseases. And next we will move to the chronic lung diseases. So in the chronic lung diseases, patient has hypoxia. When the patient is having the hypoxia, it leads to the pulmonary vasoconstriction. I will talk about how this pulmonary vasoconstriction occurs and pathophysiology, everything in upcoming videos. But here you just think, if the chronic lung disease patient has the hypoxia, that can lead to the pulmonary vasoconstriction. When the pulmonary vasoconstriction happens, that lead to the pulmonary hypertension. So pulmonary vasoconstriction, that leads to the pulmonary hypertension. So when the patient is developing the pulmonary hypertension, pulmonary circulation is directly connected with the right ventricle. So in the right ventricle want to bring more pressure to bring the blood into the pulmonary circulation because of the pulmonary hypertension. In this case, right ventricle is getting more workload, that causes the hypertrophy of the right ventricle, and which further leads to the heart failure. So means it's a right heart failure in these patients. And in the myocarditis, there is a so what is the meaning of the myocarditis? It's just inflammation. Itis means inflammation. So in the myocardium, if the heart is getting inflamed, so that is called as a myocarditis. Because of this inflammation, heart is getting damaged. Because of the muscles, cardiomyocytes are damaged, the heart can't pump properly, right? It's already damaged. So if the heart can't pump properly, which causes the heart failure in these patients. At the same time, the diabetics, and which is the risk for the coronary artery diseases or myocardial infarction, and the cardiomyopathies. Like in the cardiomyopathies, we have the dilated cardiomyopathy and hypertrophic cardiomyopathy and restrictive cardiomyopathies. And in the cardiomyopathies, these are the diseases of cardiac muscles, and which leads to the weakening of the cardiac musculature. It can occur due to genetics or some infection or toxins or metabolic disorders. Because of this, the cardiac muscles are getting weakening, and that leads to the heart failure in these patients. And arrhythmias. In the patients, they have the abnormal conduction pathway in the abnormal conduction, that's called as a arrhythmia. If the patient have the abnormal conduction, that leads to the abnormal rhythm in the heart, means in the systole, diastole, everything will be differed in the both tachyarrhythmia or bradyarrhythmia, which further leads to the cardiac muscles workload and cardiac muscle death because of the in the tachyarrhythmia diastolic period is getting reduced, and so the blood supply which goes to the coronary artery is getting reduced, so the cardiac myocytes are getting less blood supply, that's are going to weak and they will die. So because of that, these arrhythmia also can lead to the heart failure in these cases. So next of all, we will move to the clinical features. So in the clinical features, we are going to talk about two. First of all, symptoms and signs. So symptoms means patient is coming and telling you, doctor, I have these problems. And in this, as a signs, you are, as a doctor, you are going to find some features in the patient that is called as a sign. So first of all, we are dividing this into the two. So symptoms of the heart failure can be divided into symptoms of left heart failure and right heart failure. And like it's a just short review I already mentioned, so I will give the basic idea. Then like in the upcoming video, I will explain very deeply. So first of all, we will talk about the symptoms of left-sided heart failure. So a patient is coming, left-sided heart is if the in the left-sided heart is getting failure, means in the left-sided heart is attached with our pulmonary circulation. So when the heart is attached with the pulmonary circulation, if the heart couldn't pump, means in the left heart failure, left side of the left ventricle can't pump properly, so the blood will accumulated in the left ventricle, then it will accumulate in the left atrium. Furthermore, it will accumulate in the pulmonary circulation and leads to the pulmonary edema. So when it leads to the pulmonary edema, that leads to the dyspnea of the patient, or in the fatigue or weakness because of the systemic circulation, blood can't go right because the left ventricle can't pump. So if the left ventricle can't pump, the blood can't go into the aorta. So if the blood can't go into the aorta, systemic circulation blood supply will get reduced. That leads to the fatigue, weakness in the person, and cough, and in the confusion and memory problems because of the reduced cerebral perfusion. Because if the patient has less systemic circulation, the blood is going to the brain is getting reduced. That leads to the confusion and memory problems. And as a doctor, you are going to find, okay, you are going to find this is the symptoms of the left heart failure. So not. So in this case, you are going to find the signs. So which are the signs you can find? I already mentioned patient can develop pulmonary edema in the left heart failure. So in this case, if because of the pulmonary edema, you can hear the pulmonary crackles while the auscultation and the cold extremities. Why the patient is developing cold extremities? Because the systemic circulation blood supply is low. So when the peripheral blood supply is low, that leads to the less perfusion, and it's lead to the cold extremities in the periphery and in the tachypnea and S3 heart sound. Now we will move to the symptoms of right-sided heart failure. So in the right-sided heart failure, patient can develop, in the right-sided heart is mainly attached with first of all, it is attached with the superior vena cava, inferior vena cava, and when the right ventricle pumps, it's go to the pulmonary circulation. So when the blood is in the right heart failure, blood is going to accumulate in the right ventricle. When the blood is accumulating in the right ventricle, the blood will be backflow to the right atrium. Then the blood will be accumulating in the superior vena cava, inferior vena cava. Inferior vena cava is connected with the mainly with the our liver or in our lower extremities and everywhere. So lower part of our body, simply we can say. So when the blood is accumulating in the inferior vena cava, that leads to the hepatomegaly because of the because the blood is accumulating in the inferior vena cava, so in the liver is directly attached with the inferior vena cava. So if the blood is accumulating in the liver, that leads to the hepatomegaly. At the same time, the patient can develop the ascites when the hepatomegaly leads to the portal hypertension. If the portal hypertension develops, that leads to the ascites. And in the pitting edema, means the patient have in the lower limbs, because of the gravity, we are having the fluid accumulation in our lower limb, so that leads to the pitting edema. At the same time, jugular venous distension, because when the blood is accumulating in the superior vena cava, that leads to the accumulating the blood in the jugular vein also, that causing the jugular vein distension. So these are the about like clinical features of the right side heart failure and left sided heart failure. So next we will move to the investigations. So here we do blood test. Here we can find the elevated BNP because when the ventricle are stretched more, that leads to release of BNB. So because of that, we can see the elevated BNB in the blood test. And if the right heart failure involves liver, that leads to liver damage. Because of liver damage, we can find elevated liver enzymes like AST and ALT. So that's why we are doing liver functional test here. At the same time, we can do the renal functional test because if the heart failure can lead to reduced blood flow to the kidney, which can lead to the pre-renal acute kidney injury. So if it can lead to elevated blood urea nitrogen and creatinine in the blood. So that's why we are doing the renal function test in this case. So next we will move to the ECG. In the ECG we can see the ventricular hypertrophy. At the same time we can get the details about the previous myocardial infarction. And next we will move to the echocardiogram. In the echocardiogram we can find the details about the valvular causes that leads to the heart failure like the stenosis or regurgitation. At the same time, we can find the details about the cardiac chamber dimension and cardiomyopathy. Next, we will talk about the imaging studies. In the imaging studies, first of all, we are going to talk about the chest X-ray. In the chest X-ray, we can find the cardiomegaly, which happened due to the volume overload or in the pressure overload. At the same time, we can find the signs like Kerley lines. At the same time, bedwing signs. In the bedwing signs, it's happened due to the pulmonary edema. So next we will move to the treatment. In the treatment, first of all we will talk about the lifestyle management. In the lifestyle management, we have to do the fluid and salt restriction to reduce the volume overload in the patient. And we have to tell the patient to limit alcohol and quiet smoking because these can worsen the cardiac functions and increase the complications of the heart failure. So next we will move to the drug management. In the drug management, we are giving the certain drugs like furosemide, ACE inhibitors, beta blockers, spironolactone and digoxin. So we will talk about each drug separately. So in the furosemide, it's a loop diuretics. So in this case, when we are giving the furosemide, that helps to reduce the fluid overload and relieve the symptoms like breathlessness which happen due to the pulmonary edema and edema in the lower limbs. Next, we are going to talk about the ACE inhibitors. In the ACE inhibitors, that inhibits renin-angiotensin-aldosterone system and reduce the afterload. That prevents the remodeling and progression of the heart failure. Next, we will move to the beta blockers. In the beta blockers, that reduce the sympathetic activity and help to reverse the remodeling of the heart. And next to that, we will talk about the digoxin. In the digoxin, that inhibit the sodium potassium ATPase. When it inhibits the sodium potassium ATPase, that leads to increasing of the calcium in the intracellular level. When the calcium is increasing in the intracellular level, as already we know, calcium is responsible for the contraction, right? So it increasing the contractibility of the heart. So normally heart failure is heart has inability to contract, but in this case the calcium ions are getting increasing, that lead to the increasing contractibility of the heart. And next of all, we will move to the treatment of underlying causes, like if the patient has the coronary artery diseases or hypertension, chronic lung diseases, myocarditis, we have to treat the underlying causes. Next, we will talk about the surgical management. In the surgical management, there's a two in the valve replacement and revascularization. If the patient has the valvular stenosis or regurgitation which leads to heart failure, we have to do the valve replacement. We are removing that valve and instead of that we are placing another valve. And in the next we will talk about the revascularization. In the revascularization, if the patient have the ischemic heart diseases, they are having the reduced blood flow to the certain region of the heart. So in this case we are doing the revascularization to improve the blood supply to the certain cardiomyocytes. That's about the revascularization.